Oral cavity starts with the oral fissure, which is limited by the lips, yeah, superior, upper lip, lower lip. Guys, if you have lab coats, put it on, please, yeah. So, do you have? So these upper and lower lips have red part, or like, which has less thick epithelium, less thickness, and therefore we see through it the blood vessels, so therefore it is a different color, yeah. And then what we consider the upper lip, it is from the nose actually, yeah, and to the nasolabial folds, yeah, which run from the wings of the nose to the angles of the mouth, yeah. So this is considered the upper lip. And lower lip, it's up to here, yeah. So what we have up to the chin, the folder or wrinkle over here. Okay, so but it's not so crucial. Then two lips are connected with the commissure. You can see here of lips in the corners of the mouth. Then this oral fissure, yeah. So then, if you look inside, we have the oral cavity. Oral cavity is limited externally by lips, yeah, and by the cheeks. So let's say what it means, lips and cheeks. So they consist of what? Skin, which covers it from outside, okay? Then lips have muscles. Which muscle fuses with the skin? It is orbicularis oris, yeah, mainly. So, and cheeks, buccinator muscle, yeah. So here we have muscles. And from inside, cheeks and lips are lined with the mucosa, okay. So this is external wall, anterior and lateral. And then inferiorly we have the floor of mouth with the tongue, yeah, and superiorly the oral cavity is limited by the palate actually. And our oral cavity we divide into two parts. Okay, you have like, no, there is something else. Okay, the big one. What is this? Manual. Okay, so here we will have pictures, I guess. Okay, let's look. Maybe here they should be big and what we need actually. Okay. No, this is what I'm showing. It's better, yeah, we see. Okay, so the same we will see in the specimen. So actually, the oral cavity is divided into two parts, which is vestibule of oris, and then oral cavity proper. Vestibule, again, is limited from outside by the lips and cheeks, yeah. And behind we will have dental arch, yeah, superior and inferior. So it will be alveolar processes of the maxilla of the top, here alveolar part of the mandible with the teeth. And mucosa which lines these parts is called gingiva or gums. It forms the gums. What can we find in the vestibule? In the vestibule we will find folds of the mucosa which are called frenulum. Frenulum of upper lip, frenulum of lower lip. So you can see here, you can feel this fold with your tongue, yeah, under the upper lip. And a frenulum of the lower lip, yeah. So this is fold of mucosa connecting the gum with the lip, yeah. And also what is this mucosa will contain small glands, which we can say small salivary glands or mucosal glands, it doesn't matter, it's the same actually. So which are located in the mucosa of the cheek, so they are buccal glands, in the lips, labial glands, in the gingival glands, and so on. They add to the saliva what we have in our mouth. But here into vestibule opens the big the duct of the biggest gland. This is parotid gland. You know this where it is located here. Yes, so parotid gland in front of the ear. And the duct of this parotid gland opens into the vestibule of mouth. Vestibule of mouth. Where do we have this? Strange that we don't have this picture for some reason. Okay, here we have, yes, so see, this is a parotid gland. We will study it next time, but it has duct which pierces the buccinator muscle, and it will open somewhere, we don't see here, on the cheek, on the mucosa, from inside at the level of the second upper molar, yeah? We find the second upper molar, and here will be cheek, and on the cheek at this level we will find small elevation or some opening of the duct of parotid gland, okay? So this is what we find in the vestibule. So actually it is folds of the mucosa, yeah? Frenulum, this will be small glands, salivary or mucosal, and plus opening of the parotid duct. Now we are talking about oral cavity proper, yeah, so, and these borders will be what we said, inferiorly floor of mouth, and tongue also for the next time, but now we will see what means floor of mouth. Floor of mouth mainly is formed by the mylohyoid muscle, what you just recently studied, yeah. So here it is digastric anterior belly will be below it. We consider it like part of the neck, and mylohyoid muscle together with the genial hyoid over here inside, they form the floor of mouth. And then we have muscles of the tongue. Yeah. So we are interested now in this area, what is under the tongue. What can we see over there? We see like this. Yeah. So again, if we feel with tip of our tongue, under our tongue, yeah, we will feel something if you touch it, yeah, with the tip of the tongue, below the tongue, what we feel. There will be frenulum again, frenulum of tongue, and also there are some elevations. They are called sublingual caruncles or papilla, which have openings, and these openings will be openings of the ducts, both ducts of the salivary glands again. Which glands? This will be submandibular, which is in the submandibular triangle, and then sublingual gland, which is located right under the tongue, inside the oral cavity. So it forms the elevation which runs from the frenulum of tongue laterally, and this elevation of mucosa is called sublingual fold. Okay, so therefore what do we see under the tongue? It will be a frenulum of tongue, sublingual caruncles, yeah, or papilla, and then on the laterally to it we have sublingual folds, inside of which we will find the sublingual glands, yeah, what we can see over here. Now what? Palate, the upper wall of the oral cavity, yeah. So palate has basis which is formed by the bones, as we know, yeah. Let me see here. Okay. So the bony palate is formed by the palatine processes of the maxilla and horizontal plates of the palatine bone here in front of the pterygoid processes. These bones are connected by the sutures, median palatine suture, transverse palatine suture, has some openings, but if you look from the oral cavity, it all will be covered by the mucosa, okay? And in the midline, we have elevation, which is called palatine torus. Let me show. Okay, here we can see, yeah, like this in the middle, but we don't see this elevation. Sometimes it's very developed very much, so it's difficult then to adjust the prosthetic upper teeth, yeah, so when people don't have teeth, for example, and they need prosthetic. In front, what do we have? Some folds, yeah, which help us to chew actually a little bit. If you sucked candies, yeah, we do what? We usually push it next to these folds, yeah, and suck like this. So especially they like develop these folds in animals, yeah. If you've ever looked inside the oral cavity of the cats or dogs, you saw this very pronounced, yeah. It helps to chew actually. Okay, so then the palate is divided into the hard palate, actually, which covers mucosa, which covers the bones, and then we have soft palate. Soft palate, or here behind, is attached to the hard palate, yeah, over here, and then it hangs mainly downward. So therefore, it is called in Latin palatin velum. Velum means like curtain, yeah. And here we can see this soft palate. This is hard palate, yeah. Under it we have some mucosal gland, which are palating gland. Again, we can consider it like small salivary glands, and vessels and so on, nerves. And then soft palate. Soft palate mucosa also has glands, but mucosa forms folds, yeah. So what do we see, what do we find if you don't remove the mucosa? We see like this picture, okay? When we open our mouth and say like, oh, like this, yeah? Or if we push like somebody, yeah, when they look at our throat, push the tongue down to see like this picture, we can see this. We see opening, yeah, which runs from the oral cavity into the pharynx. And this opening is called fauces or isthmus of fauces. So this opening. It is bordered by what? Below we see the tongue, above soft palate, okay? In the middle of the soft palate there will be a small tongue, how we call it? It is uvula. Uvula, and on the side of the uvula there will be two folds, yeah, or pillars, palatine pillars or folds. How do we call these folds? They one runs from the palate to the sides of the tongue, so therefore it is called palatoglossal, and the other one runs from the palate to the wall of the pharynx, so therefore it is called palatopharyngeal. And between them we have fossa, tonsillar sinus or tonsillar fossa, where we have the tonsil, palatine tonsil, yeah. So this is important lymphoid organ or immune organ, the biggest gland, the biggest tonsil of pharyngeal lymphoid ring, which we will study later. So it's immune organ, yeah, protect our body and like different microorganisms, viruses, and so on. Okay.